G'day guys, Jack and Ninja here. How you doing, Ninja?
Yeah, really good, thanks man.
Excellent. We're going to be looking at Ninja's feet today. He's got a bit of plantar fasciitis, been running around a little bit too much on those, out doing those barefoot sprints, and it's starting to catch up with his heels. So we're going to start by having a little bit of a look at what's going on in Ninja's lower leg, have a bit of a look at what might be causing the pain that he's experiencing around his heel. Then we're going to go through a little bit of treatment and a couple of really basic rehab exercises that if it's something you're experiencing, you can just have a bit of a crack at home, see if it makes a difference. So I'll get you up and we'll go over towards the wall, Ninja. So one of the classic things we see with plantar fasciitis really commonly, particularly in people who run a lot, whether it's sprinting or longer distances, is that they will have really tight calves. And so if the calf's really tight, all of these muscles here, which attach down to the Achilles tendon, will start to pull really hard on the fascia that's underneath the heel. And you get these little micro tears, a bunch of inflammation building up, and over the course of time that results in what can be sometimes quite a lot of pain. So a quick way to test whether or not your calf is quite tight or you have limited range of motion in your ankle is to do what Ninja's doing over here. Come on and check this out, Leo. So you want to start with your big toe as close to the wall as you can, and you want to then
Taxi.
you want to then move your knee toward as far as you can towards the wall, without the back of your heel coming up off the ground. So if your calf is really tight, you quite possibly won't even be able to get it there, even with your toe touching the wall. But yeah, as you can see on this leg, Ninja can get quite a decent way out before his heel starts to get out, starts to come up off the ground. So that indicates that, Ninja's indicating he's probably got some pain or some tension down in this lower part. Yep. So that's a good sign that this is going to be a good and really useful place to work on for Ninja to help alleviating some of this pain. So jump down on the table, mate. We'll have a bit of a go through. Yep. Now, whenever I'm working on plantar fasciitis, I do prefer to start with the calf itself, even if there's not a whole lot of restriction in the motion here, just to get all of this musculature loosened up, because that's going to help take the pressure off the Achilles tendon and off the plantar fascia in the first place. So I'm just going to start by just doing some of our pretty classic strokes, using my pisiform bone to really sink in off the top of Ninja's heel bone, top of the calcaneus where that Achilles tendon inserts in, and just really quite broadly and relatively shallowly, at least for us. Ninja might disagree with you getting up through there.
Yeah. Speed in there.
Yeah, up around there, hey?
Yeah. All through it, really.
Yeah, that'll do it.
Yeah.
And we just want to really stretch out those calf muscles, really get that fascia to start opening up. Have a bit of a flush through there as well, get any debris, any leftover lactic acid that's kind of stuck in those tight muscles to flush back out and up the leg. Again, we do the same through the other side, hitting the lateral side of the Achilles, lateral soleus, lateral gastroc. Holding up all right with the pressure there, Ninja?
It's good, man.
Awesome. Just really scooping our way all the way up. And then a final line, again, pisiform really hooked into the top of the calcaneus. And just tracing straight up the middle with my pressure and my focus really centered on that pisiform bone. Just thinking about running that right up through those two heads of the gastroc. Getting all of those deep muscles in the calf to start opening up. And taking some of the pressure off. All right, now if there's anywhere in there that really stands out, or if there was really significant restriction in that little calf length test that we did just before, then I would probably spend a little bit of extra time maybe using an elbow to dig into some of those spots, make sure that there's nowhere that's really like knotted up or bunched up. But for the sake of the video and for the sake of you guys, we're gonna move on through and get into the deeper cleaning stage of things. So I'm also gonna do a little bit of an opening stroke with my knuckles down through Ninja's plantar fascia. So there's a couple of different places that plantar fasciitis can present. Sometimes you'll get it along the back of the heel here. Sorry, Ninja's probably a bit ticklish. Sometimes you might get it underneath here, which is like more on that anterior aspect of the calcaneus. You might even get it up along here. It might even present a little bit more like Achilles pain, or you might get it somewhere down through some of these areas, even down around the big toe. So I'm just gonna start by getting my knuckles in, sinking in at that anterior edge of the calcaneus, and just pretty broadly dragging down to start opening up that plantar fascia. Just having a little bit of an explore, getting an idea for where things might be sore or tight, seeing if there's anywhere that really stands out to us. But still, yeah, keeping it relatively light, keeping it like enough pressure for it to be therapeutic, of course. Just getting all the way through. Just have a little bit of an idea of what's going on. And then, so basically then I'm going to go in and let's start by assuming that maybe Ninja has some pain through here, through that anterior edge. I would just find wherever that pain starts along that arc and start by sinking my thumb in and getting really deep into that. Because we're often working on areas that can be a bit inflamed, can be quite sensitive. This is often quite a slow process. Like one stroke along, like one nice deep cleaning stroke along this area might take as much as 15 or 20 minutes, depending on how aggravated things are, how much pain there is there, how quickly things are moving. But we want to really make sure we're focusing on scooping out and flushing out as much of that inflammation as possible, bringing as much new blood flow into those tissues as we can, getting things to open up, to start healing and repairing, and ultimately encouraging the tissues to open up and respond in a way that's not going to be creating so much pain. So again, speeding this up quite a lot for the sake of the video, although we're getting some pretty good twitches from Ninja there, as you can see. But yeah, again, if it was more on the back of the heel, I might start more on the back, work my way around the top, working through that posterior edge, finding anywhere that's sore and digging into it, making sure we're really opening it all up. And just working our way around. Possibly even up the sides here, making sure that we're flushing out all of that fascia and all of that tendon that connects into the Achilles tendon, getting all of that connective tissue to clear out, making sure we're not leaving any little bits in there. Feels like there's a little bit of bubble wrappy stuff in there, so I'm just gonna do a little bit more through there. There we go. And a little bit of a hiss. It's always a good sign.
Yeah.
And then perhaps, if there was a bit of pain through the medial arch, I might go down and sink through all that deep fascia in there. There we go. There, we found it, as you can probably hear. Holding up all right there, mate?
Yeah.
Awesome.
Bit in there.
These feet get a workout. But yeah, one of the common mistakes people often make when they have something like plantar fasciitis, there's a couple of common mistakes I see people making in trying to manage or help it out themselves. One of them is that they get a whole bunch of tape and they will just tape their ankle and support to create a bit of extra support there in their ankle to take the edge off the pain. And while this is really useful short term in really specific circumstances, if this is something that you're ending up relying on, you're actually going to be exacerbating the problem and making it worse, because you're going to be encouraging the muscles that your foot needs to actually support itself without pain and to operate smoothly and to operate normally. Instead of those working and getting stronger and being able to support your foot, you're actually going to be encouraging them to atrophy and get weaker, which is ultimately going to either make the pain worse or certainly prevent it from healing and from going away. So you want to be quite careful with your application of tape and those kinds of things. Very, very useful tool, but very easy to misuse as well. And another one is that people assume, a lot of people assume that plantar fasciitis or foot pain comes from having weak calves. Often, as you might have seen from that, or might have kind of been able to pick up from that test, often it's actually the opposite. It's more that there's weakness in other areas other than the calf. And so, I've seen people who've come in and they've been spending weeks, maybe even months, doing these really heavy calf raises with quite significant amounts of weight, and their pain's not going away, or if anything, it's getting worse. And really, it's like, well, you're just making this muscle here tighter and tighter and tighter, and it's pulling harder and harder and harder on the foot. Of course, it's going to be making it worse. It's not, it's a little bit counterintuitive, unfortunately. But yeah, we've got to get the rest of the feet moving and getting strong to start to encourage that healing process to happen, rather than just being super dominant on the back end. So I'm just going to finish off this line on Ninja, and then I'm going to go through a couple of little exercises you can start to have a bit of a play around with that'll perhaps be a little bit more useful. Of course, if you don't have access to one of us or anything like that, you can always get a massage ball, like a lacrosse ball, a spiky ball, a golf ball, maybe even like the edge of a seat or something like that, something you can put your weight onto and really sink into some of these little crevices to start trying to flush some of that pain out of your own body. But ultimately, that's always the first part. That's the clean stage. But when it comes to the build stage, making sure you're doing the right kinds of exercises is really important, especially to keep it away for good and to be able to get back to any activities that might have been preventing you from doing, whether that's just being able to get through your shift at work nice and smoothly without any pain, or whether that's being able to get out on the road and go for a nice long run or whatever else it might be. So just sit on up for me for a sec, Ninj. Feeling pretty good?
Yep.
Amazing. You're a good sport, mate. All right, so the first one we're going to go through is just a really, really simple, and these exercises will look really simple and probably like there's not like they're not doing a whole lot. But what we're doing is we're starting to address some of the imbalances in the lower leg that are causing this kind of pain, or at least contributing to it not healing at the very least. So the first exercise we're going to do, Ninj, is just some little toe raises. So we're just going to start here. This is completely unweighted. This is the first stage of the progression of this exercise. So we're going to start and we're going to leave our heels on the ground, and we're just going to raise the fronts of our feet up, and then we're going to let them back down. We're going to raise them up, and we're going to take them back down. That's it, and we're going to do that. And if we were doing a set of this, we'd do this 20 to 30 times, and we do 2 or 3 sets of that. And if your lower legs are in pretty good shape and they're not having a whole bunch of issues and there's not major weaknesses there, this is probably not going to feel like a whole lot, certainly for the first set. But after the second or third set, even if you've got fairly strong lower limbs, you're probably going to start to feel it a little bit. It's one of those exercises, particularly if you're really bringing it up as far as you can. You can probably bring those up a little bit further, Ninj. Really lift those toes up and lift those feet up as high as you can. Really squeeze it at the top. Make sure you're getting a good clean rep out of it before you lay them back down. Don't just flop your feet down either. Lower them back down, get that eccentric contraction as well as the concentric on the way up. Just make sure you're getting the most of it. After a while, that's going to start to burn a little bit. The second stage of the progression, so if you're doing that, you've got your 3 sets of that down, it's not feeling too bad, you feel like you're ready to go on to the next stage, starting to see some improvement, The next stage of it is just to do exactly the same thing but standing up. And so again, we're going to have our, we're going to be in our, what we know as our good healthy posture, where most of our weight is centered over our heels rather than forward over our toes. So we're going to be nice and stable in that position. You might like to have a little bit of core activation for those of you who are not familiar with this. You can start to bring this in by just letting your weight sink back over your heels and getting a little bit of activation in your core. Maybe just consciously engaging your abdominal muscles just a little bit to stabilize you. And again, we're just going to be going up and down, up and down, up and down. Try not to rock too far forward and back there, Ninj. It's not a hip thrust. It's a toe raise. And again, you want to start with between 10 and 20, maybe up to 30 of those. That's really, really good. And then if you want to take it to the final stage and make it a little bit more complicated, you can come over to a wall somewhere, have your feet forward and your bum resting on the wall, and you want to go at about 90 degrees, hands resting on your knees, and then doing the same thing, but you're really exaggerating the angle, right? Because we've got a much greater angle between between my feet and my shins, there's further for my feet to move, and there's more weight going through there because of the angle of the force, and that's going to get even more challenging again. If you're not feeling the other ones, you will definitely feel this one by the time you get to 20 reps. That's just one exercise. There are definitely a few other ones that are really, really helpful, but we're going to leave it there for today. It's a good place to get started if you are suffering from plantar fasciitis, whether that's from running, spending too much time in bad shoes on your feet at work. And probably the main tip I will always give to everybody is you got to get your shoes off. You got to be barefoot. You got to get out on the ground, out on the grass. You got to walk around in your home barefoot. You got to let your feet move, let the toes expand, let those metatarsals move around, and just do all this stuff, but with your feet. You got to you got to be able to feel the ground. You got to let your feet adjust and get them used to adjusting. And if you've had an injury with your ankle or something that's led to this, that might feel a little bit scary. So just start small. You don't have to push it super hard. If it starts to hurt, obviously back off again. Feel free to shoot us a message if you need any other tips or anything like that. But give it a go. See what you think. Clean those feet out. Get them nice and strong. Feel good. Be able to do what you want to do. Thanks very much, guys.
Thank you, man. Done. Well done, man.